My name's Chris Weis. I'm a small business owner and a toxicologist. 25 years ago, my job was to rapidly assemble teams of experts, scientists, and respond to some of the worst disasters in the United States. And so that was my job. It was a great job. It was exciting for a young guy at that time. I no longer fit that description, but it was a good job. And I was at a meeting in Helena, organizing public health experts, et cetera, to talk about preparedness for such a thing, perhaps a wildfire, a flood, or whatever that might happen in the state of Montana. My pager rang. And my boss in Washington, D.C. said, Chris, get a flight right now and go to Libby, Montana. There's been a national news story indicating a disaster in Libby. And so, of course, I did that. I happened to be with a physician who was working very closely with me from the Centers for Disease Control. We were both on the same team, Dr. Aubrey Miller. Some of you may know him. And so Aubrey and I gathered a communications expert in Helena, chartered a flight, and landed at the airport outside of town here. Spent a couple of days here and learned as much as we could in those 2 days. And during those 2 days, we learned that the situation that we read about in the newspaper, in the Seattle Post-Intelligencer, was only a very small part of the story. We went home for Thanksgiving, somewhat in shock, frankly, from what we had seen and experienced. And we returned 2 days later, and I spent the next 2.5 years commuting from Denver to Libby Monday through Friday. I had 2 little kids at home, a wife. One of the first things we did, and I argued with my management vehemently and many others, that in order for me to do my job as a toxicologist and an exposure scientist, I needed radiological data. I needed biological data. I needed biological evidence of what I thought was going on, but it was not empirical. I didn't have data in hand to go back to Washington and ask them for what I anticipated to be one of the largest events that the Environmental Protection Agency had ever addressed. And so I recommended, again, argued vehemently with a number of people, a number of other federal agencies as well, to build a clinic in a vacant lot here in town. And I'm so thankful for the project manager. I was simply an advisor, a science advisor. The project manager also showed up on the site with the same orders I had. So there were 4 of us, the project manager, myself, Dr. Aubrey Miller, and a communications specialist. And we argued and won the argument that we needed a clinic in town. We built a clinic that spring. It was November when we came in. By the time the snow melted and the frost came out, we had established a clinic here with a triple wide trailer. And thanks so much to Dr. Brad Black, who coached us through this entire process. Brad, I love you for that. We built a clinic, and Brad stepped up to assist us in that and be the principal physician in that clinic. Brad was the public health doc here in town at the time. We bought radiology equipment. We built the clinic so that we could have private interview rooms in the clinic. By that fall, we had screened 7,000 people, and the preliminary data showed us that 18% of that population was affected by pulmonary disease. At the end of that summer, it began one of the largest, if not the largest, project that the Environmental Protection Agency ever undertook to remedy that problem. The first phase was a that emergency response team lasted about 2.5 years approximately, and then that team turned it over to a long-term remedial team that then took over and is still working here in town, as those of you know. During that time, the team that was the National Emergency Response Team also had to respond to the World Trade Center incident. I personally led a team into the Hart Senate office building in Washington, D.C. that had been contaminated with anthrax. But we really wanted to be here. And after those incidents, we came back, finished up our responsibilities and duties here, learned to love Libby, learned to love the people that are here, and did everything that we could during that emergency response phase to help those folks out. I'm back here. It's 25 years later. I still love Libby. It's so good to be back here. And now we're looking forward to what can we do? What can I do? I'm no longer with the federal government. And there's a wonderful team here today. There are many, many others that couldn't make it today, but I want to just assure the team members that are here know this well, but I want to assure you that there's an entire science team that is striving to learn as much as we can about this disease, about the problem, and especially how to do whatever we can to protect the city of Libby and this wonderful community. So I came really to listen. I didn't really come to talk this much. I came to listen, talk to people in Libby. I've done that for the past three or 4 days now. And I'm open to any kind of questions, suggestions, anything that you would like to know that I can, humbly help you with.
But in the future, what do you think? Is it funny if you're going to still be around for us people?
We've talked about that a lot over the last few days, and to me the most important thing are the kids that we saw this morning. So sweet and wonderful, and there's a lot of work among the team of people here. I'm not directly involved in that, but I'd like to emphasize that that's really the folks those kids are the ones that we're really interested in and really want to make sure that they grow up in this wonderful town without the problems that their grandparents had and their great-grandparents and their parents perhaps.